Virginia state lawmakers are currently considering how to use billions of dollars in federal funds from the American Rescue Act. Mental health is a top priority in the wake of a crisis that's forced 5 state mental health facilities to temporarily shut down. That's placed an even bigger burden on private facilities. In this week's You Are Not Alone report, our Tracy Sears talks to a Powhatan mother who says she couldn't find help for her daughter until a judge stepped in.
She is the sweetest girl. She really is.
Kelly Bradley says it's been difficult watching her 16-year-old stepdaughter, Joni, spiral. Stress and isolation of a pandemic further complicating mental health issues that she suffered since childhood.
Me and my husband hadn't slept, and we're both trying to take turns.
The Bradleys knew they needed to find a mental health facility for their daughter when she repeatedly began running away from home, disappearing one time for 11 days.
We thought she was in a ditch somewhere for that many days.
But their efforts to find an open bed at a behavioral health center or hospital were unsuccessful.
And I told all of them, she is going to run again. They knew she needed a bed. You know what I mean? And their hands were tied.
The Bradleys are not alone, as many families are struggling with a mental health crisis that's only grown worse over the course of the pandemic, leaving both private and public mental health centers overburdened and understaffed.
We've got to make the investments into the community. That's the only way we're going to solve this problem long term.
In a special session of the General Assembly, state lawmakers are considering a $485 million investment in Virginia's behavioral health system, using state and federal funds to support state mental health hospitals and community-based services and substance abuse treatment and prevention programs.
We are seeing a concentration in substance abuse, certainly a higher rate of overdoses than we saw pre-pandemic.
Dr. Jake O'Shea, Chief Medical Officer with HCA Virginia, says despite 526 beds dedicated to behavioral health, the largest for a private provider in the state, the demand is still overwhelming.
We have to assess every patient that comes into our facility based on our capability to manage what's going on in the hospital that day, our capacity, how many beds we have available for patients, and really take each patient individually.
O'Shea says he hopes state funding will shore up more resources in the community to keep people out of crisis mode where hospitalization is required.
If I hadn't kept going and fighting for her to get residential, she would be home right now.
Bradley says it took a judge's court order to find her daughter an available bed at a behavioral health facility, a task she says should have never been that hard.
She's 16 right now. I have 2 more years to get her the help that she needs before I have no say in anything.
For You Are Not Alone, I'm Tracy Sears.
If you are struggling, you are not alone, and there is help available. Just go to WTVR.com/youarenotalone to see a list of resources.